I am an ex-smoker. I quit smoking 10 years ago.
I'd been smoking since I was 12. I was smoking for 59 years. And so I figured I should have things checked.
It's a well-known fact in medicine now that early detection and preventative care is the best route to wellness.
My brother was always just healthy as a horse, as they would say, and just never had any medical issues at all until they found out that he had lung cancer and it had already spread.
Many people are very frightened by the word cancer, and so they hesitate in getting testing done in case they do get a diagnosis they don't want to hear.
You know, had he known a little earlier, I think his outcome certainly could have been very different.
You know, it's time I took charge and said, okay, I'm going to quit and hopefully have some nice long years ahead of me.
It just prompted me to see what I could do to proactively take care of myself. And so I went ahead and did the lung screening CT.
There are two major ways to reduce the risk of lung cancer. The first is to stop smoking if people are currently smoking, and the second is to try to catch lung cancers early. When we find a lung cancer early, we're oftentimes able to cure patients.
For some patients, the perception of lung cancer is that it's terminal, but that's not always the case. Lung cancer screening has been proven to detect lung cancer early when it's still in its treatable stage. Even if patients are still smoking, or even if they're afraid of the findings on CT scan, it's important that they undergo lung cancer screening as part of their health maintenance.
By undergoing screening, it's an opportunity for us to help those patients reduce the risk of developing an advanced cancer and help us to cure them.
But the only way to detect lung cancer early if you are a smoker is through lung cancer screening. And that's specifically targeted to high-risk group patients.
Folks who are over the age of 55 and are either currently smoking or have previously smoked and have quit within the last 15 years.
On the day of the CT scan, patients arrive at a dedicated scanning center and undergo a low-dose screening CT. Low-dose CT scans have far less radiation than normal CT scans.
Many patients will have a normal CT scan with this screening examination, and that's wonderful.
Of every 100 patients scanned, approximately 15 to 20 will be found to have a lung nodule, and one of those will be lung cancer.
It is important to remember that this screening is not just a one-year process. It's something that people sign up for to do on an annual basis so that we can catch any lung cancers early throughout their lifetime.
Our lung cancer screening program is more than just a CT scan. It involves smoking cessation, a low-dose screening CT for lung cancer, and comprehensive follow-up for any abnormalities found. If a nodule is found, our lung cancer screening program is there to help patients navigate through this system. We have a multidisciplinary team, including pulmonology, radiology, oncology, radiation oncology, and CT surgery. This team is at the disposal of the patient to provide the best possible patient care for the best possible patient outcome.
The CT screening program at Wake Forest is a unique resource for the region. We are the only institution in the state of North Carolina to participate in the National Lung Screening Trial and have been leaders in this arena for many, many years. Current guidelines for CT screening recommend that patients undergo screening at an institution that has significant experience with the procedure as well as the workup for any abnormalities. At Wake Forest, we have that level of experience.
It's a disease process in our society that brings fear to the heart of many, and this is the best way to be sure and stay well.
Take charge of your own health and do all that you can do.
Anyone that is interested in keeping well and staying well and enjoying their life, go the preventative medicine route.